What do you think of when you hear the term ADHD? Attention Deficit Hyperactivity Disorder might make you think of a child who is disruptive, hyperactive, loud. In other words, difficult to miss. Boys are 3 times more likely to be diagnosed in childhood than girls.
The way to prevent the really severe outcomes in adulthood is obviously to try and identify it and support people while they're still children.
The medical consensus is that there are as many women with ADHD as there are men.
What we did see was that there were actually girls coming into the population of people with ADHD after childhood, which is kind of something that people thought couldn't happen.
Are women developing ADHD late in life? Or is it possible that they're being missed?
The myth of hyperactivity, which means that quiet, dreamy girls of the kind I was don't get diagnosed.
The diagnosis is for a certain type of boy.
3 women, diagnosed at very different stages in their lives, told me about their experiences.
You can't possibly have ADHD. And it just gets so frustrating to hear that over and over and over. It really is difficult.
Rebecca at 12, Claire at 20 and Nikki at 40. I wanted to find out why so many women are being diagnosed so late.
So I was diagnosed at the age of 12. My brother at the same year was the age of 9, and he was hyper, so he was diagnosed first. But if he hadn't been diagnosed, I probably never would have been picked up.
Partly because women and girls present differently, often. Partly because I really liked learning. So I didn't cause any problems in academia. I was particularly good at staying engaged and not causing any problems and that kind of stuff. See if anybody else is posting.
Rebecca is a psychotherapist. This is the social group she runs for adults recently diagnosed with ADHD.
No. I am always here. I am always here.
Most of those who attend are women.
There was nothing on the NHS. There was nothing privately. There was absolutely nothing for adults anywhere. So I thought, well, maybe this is something that I could help people with. So when you get this diagnosis as an adult, you suddenly go through this whole journey of looking back at your life and going, oh my God, that's why this happened. That's what was going on. That's why I behaved that way. That's why it was misinterpreted. There's a huge journey.
During the evening, we met Nikki, a long-time member of Rebecca's group.
So from spending sort of 40 years in the world not being remotely typical and very noticeable, it's suddenly, well, you're really typical for an ADHD. People like you are everywhere. ADHD planet.
You're braver than me. I tend to try and work the other way. So I've tried to fit in for most of my period of time and, figure out how to sort of make it work. But what I try and do is then bring people on side.
Well, Dr. Bose says that he can split his ADHDers between those who mask and those who don't. And I certainly don't mask, because I find I operate in gears, and if I'm in first gear, second gear, third gear, I can look like everyone else, but I don't get anything done.
But how can something like ADHD be masked or hard to spot? Girls can and do show hyperactive symptoms. It's something their parents report to doctors to get a diagnosis. But the other side of ADHD, the inattentive side, is much less visible. It's more about a sort of seesawing focus or a restlessness on the inside. And studies show that this type of ADHD is twice as likely to be found in girls as it is in boys. I went to the Institute of Psychiatry to speak to the experts.
ADHD is just often missed. So it tends to get picked up more in boys who are very overactive and disruptive, just because you notice them and they're more of a problem. And the girls are perhaps less likely to be like that, so more they're being picked up because of the dreaminess and the inattentiveness. But actually, ADHD can also be just as severe in boys and girls, or girls and boys.
So it could be that they sort of always had these feelings, restlessness or inattention, that may be both more common in adulthood and more common among women. But parents and teachers didn't pick up on them, and then when we ask them to self-report about their ADHD symptoms, they start to meet criteria.
But as you get older, Actually, more women are noticing that they're inattentive, but also they get a lot of emotional symptoms. They get frustrated and irritable and angry, and often they're being diagnosed with anxiety or depression, or even severe conditions like bipolar disorder or borderline personality disorder. So they've never been given the right treatments.
I travelled to Cambridge to meet Claire, a university student.
I have like a t-shirt that's like so enrolling.
Before she was diagnosed with ADHD last year, it was suggested she just had anxiety.
I feel like it does fall in gendered stereotype lines. They were asking, are you anxious? Is it something in your personal life, etc.? And it's like, well, everyone has their own like personal life, but like kind of it is like, oh yeah, it does affect my sleeping, it does affect this, but it wasn't working. I am a lot happier having the diagnosis. I feel listened to and like appreciated, or like I can get the tools to appreciate myself instead of just being like, I do not fit in.
After a GP told her she might have ADHD, Claire's mum was asked to fill in a questionnaire describing Claire's personality as a child. Its key indicators describe things you can easily see: excessive running or talking, acting as if driven by a motor. But Claire feels that she's always had to work harder to cover up the difficulties she's had.
The actual diagnosis, like, it's a conversation with my psychiatrist, but at the end of the interview conversation about ADHD, she said, your mum hasn't scored you highly enough on your childhood questionnaire for me to diagnose you now. And I think even in the same breath, she's like, even though you have ADHD. I would speak in class a lot, but I'd be putting up my hand and be that kind of like teacher's pet, kind of kid, and like I was trying so hard to not present as what I would have seen as weird as a kid or worthy of like getting into trouble. That habit I was in of trying really hard pushed me to try hard everywhere, so it means that like ADHD and the kind of like tools I had to hide my ADHD worked really well in a classroom setting. ADHD, the like symptoms and like effects of it are just labelled as rude. The whole questionnaire when you're a child is done negatively. It's done negatively and done as like, was she acting out? Was she bouncing off the walls? Was she like being like almost like aggressive? And it's like, that's a very specific type of person and often falls on a gendered line. It's the problem of invisible disabilities that like you're invalidated by on so many sides.
Claire's story is a common one. For many women we spoke to during our research, the road to diagnosis was frustrating and long-winded. So should the NHS be doing more to accommodate these women? A Department of Health spokesperson said,
"Early intervention is essential in supporting anyone with ADHD. That's why we recently updated guidance to make it easier for doctors to spot and diagnose the condition so that all patients can access the best treatment and support. The draft guideline recognises that girls and women are more likely to remain undiagnosed or be given an incorrect diagnosis, as they are more likely to present with symptoms other than hyperactivity. Whilst clinical guidelines are not mandatory, adherence to them will support improvements in the quality of care."
People with ADHD are often told they just need to try a bit harder. Dreaminess, inattentiveness, ditziness, they all sound like personality traits. Doesn't everyone find it a bit difficult to be organised all of the time, to concentrate on boring things? So what is it about ADHD that makes it a disability?
And in ADHD, people describe a kind of very uncontrolled type of mind wandering. Their thoughts are constantly on the go. They jump and flit from one thing to another. They have multiple thoughts all at the same time. And, when they're very severe, they can start to have a really significant impact on your life.
Societal pressure can make women feel they need to mask their ADHD symptoms. But this can take its toll.
Women have been putting in a lot of effort to compensate for and to hide their ADHD symptoms as they're growing up. So they may kind of be successful at it earlier in life, but it's not something that has no consequences, that there's kind of an emotional exhaustion that comes with constantly compensating for things and trying to please if you kind of have this neurobiological deficit that you're continuously compensating for with others.
I met Nikki at Rebecca's social club. After spending years trying to fit in, she's now a self-proclaimed, out and proud ADHDer.
Anyone who knows me knows that I can sit still for hours. I don't fidget, it's just my mind never stops. So no one was ever going to diagnose me with ADHD. So until I found out about ADHD myself and what it looked like, I was never going to get that diagnosis. What happened was that someone walked into my office, 20 years younger than me, male, out and proud, ADHD. I took one look at his social presentation and thought, I've got what you've got. And after that I researched it, and I researched it properly, beyond the hyperactivity, or the myth of hyperactivity, which means that quiet, dreamy girls of the kind I was don't get diagnosed. What I learned is that it's all about fluctuating focus. Sometimes the glasses are in place. My focus is really good, especially if I'm doing something I'm interested in, and then suddenly somebody whips the glasses away and I'm stumbling about in the dark and looking like a fool.
Nikki's ADHD has become so severe that she's considering taking medication, something she hasn't done for 7 years.
Dr. Bose, who diagnosed me, is of the view that the medication would stop this constant situation of focus, no focus, would stop the feeling of moods changing, which comes with focus changing, and I've got an open mind, but I don't yet know whether I want medication or whether I don't.
Nikki's invited us to an appointment with her psychiatrist. She wants to discuss medication options.
Hi, hello. Have a seat. Yes.
If she decides she wants to start, she'll be one of only 0.3% of women with ADHD on medication.
I need something, which will stop me having 4 moods in one day, which you say that the non-ADHDer has that filter which keeps it out. But anything that sort of takes the shine off me when I'm happy and functioning and focused, I'm not going to enjoy.
No.
And that's why I didn't enjoy methylphenidate.
But that's why you have to try many of these drugs, because usually in the end you can find one that is suitable for you. And the different medications actually, they suit different people, and some person who's done very badly on one of them can do very well on another one.
Since Nikki's moods are linked to her focus levels, Dr. Bose has prescribed her with lisdexamfetamine. It's a stimulant that increases the brain's dopamine levels, helping her focus.
Thank you.
However, a week after the appointment, Nikki told us the drug wasn't working.
In terms of what you asked what the ADHD diagnosis means to me. What it means to me is the expansion of the universe.
It validated all my question marks of like when I didn't quite speak up. The feeling is that like, oh, everyone experiences this, and it's like, no, actually my feelings are different, because like I feel like I have all these words, but too many words, and that I don't speak the same language as everyone else.
What would it be like if I took the words away and just listened to the music?
I thought I was, a bad person, and that to listen to myself, that like that's not normal to feel like you are not a good person every single day.
But the only way that we can sort of get that message out is to be proudly ourselves. Be out and proud. I am ADHD, this is who I am in the world, and I will keep being this until you're used to it.
It is a validating process, and that like my ADHD is a good thing.
It gives me the confidence to be who I am in the world, to not mask, to not tone it down, to kind of say, hey, this is my piece of ground, this is what I stand on, and this is what I'm going to keep standing on.